Dear students, now we have to learn retroperitoneal space and kidneys. Abdominal cavity consists of peritoneal cavity and extraperitoneal space. Parts of the extraperitoneal space are retroperitoneal space, retropubic space, and retroinguinal space. In left picture we have horizontal section, in right picture we have sagittal section of the body, and blue colors represent position of peritoneal cavity, and green color with blue star represent position of retroperitoneal space. The retroperitoneal space lies posterior to the peritoneal cavity and anterior to the musculoskeletal structures of the back. Some organs of the digestive system like duodenum, ascending descending colon, and pancreas, urinary system like kidneys and ureters, and endocrine system like suprarenal glands lie within this space. Anterior border of the retroperitoneal space form the parietal peritoneum. Posterior border form the vertebral column, iliopsoas muscle, quadratus lumborum muscle, and transverse abdominal muscle. Superior border form the diaphragm. Inferior border form the pelvic diaphragm or levator ani muscle. In the retroperitoneal space, we have primarily and secondarily retroperitoneal structures. Primary retroperitoneal structures are adrenal or suprarenal glands, kidneys and ureters, aorta, and inferior vena cava. Secondary retroperitoneal structures are the parts of the duodenum, except the superior part, pancreas, except the tail, and ascending and descending colon. This is the major part of the urinary system, but only the kidneys and ureters are the parts of the abdominal cavity. We shall start with the kidneys. The blue color represents position of kidneys. The kidneys are retroperitoneal organs in the posterior abdominal region. The bean-shaped kidneys lie immediately lateral to the vertebral column. Although they are similar in size and shape, the left kidney is a longer and more slender organ than the right kidney, and its position is higher than the right one. In the picture, you can see relationship between the right kidney and inferior vena cava, and left kidney and abdominal aorta. Because we have on the right side liver, the superior pole of the right kidney is at the level of the upper border of the 12th thoracic vertebra, and the superior pole of the left kidney is at the level of the upper border of the 11th thoracic vertebra. The inferior pole of the right kidney is at the level of the 3rd lumbar vertebra, and the inferior pole of the left kidney is at the level of the lower border of the 2nd lumbar vertebra. In the fetal development and after that in adult, the kidneys are the primarily retroperitoneal organs. In the left picture, you can see right and left kidneys behind the peritoneum. On the external surface of the kidneys, we can describe superior pole, inferior pole, anterior surface, posterior surface, and lateral border and medial border. In the middle of the medial border, we have renal hilum. This is the gateway for the vessels and urinary system. On the superior pole of right and left kidneys, we have right and left suprarenal gland. In the renal hilum, we have renal artery, renal vein, and ureter. If we look at anterior surface of the kidneys, first we have renal vein, and little bit posterior and superior from vein we have renal artery, and little bit posterior and inferior from renal artery we have ureter. We shall repeat now that the hilum transmits from anterior to posterior the renal vein, the renal artery, and the ureter, VAU. Lymph vessels and sympathetic fibers also pass through the hilum. The renal sinus contains the upper expanded part called the renal pelvis. Perinephric fat is continuous into the hilum and the sinus and surrounds all these structures. The right and left kidneys have different relationship with other organs. A small part of the upper pole of right kidney is covered by right suprarenal gland. The rest of the upper part of anterior surface is related to the liver and is separated by a layer of peritoneum. The second part of duodenum lies directly in front of the kidney, close to its hilum. The lower lateral part is directly related to the right colic flexure, and on its lower medial side is related to the intraperitoneal small intestine. A small part of the superior pole of left kidney along the medial border is covered by left suprarenal gland. The rest of the superior pole is covered by the intraperitoneal stomach and spleen. The retroperitoneal pancreas covers the middle part of the kidney. Its lower lateral part is directly related to the left colic flexure and beginning of the descending colon. Its lower medial part is covered by the intraperitoneal jejunum. The right and left kidneys on the posterior side have relationship with green color represent relationship with diaphragm, red color with transverse abdominal muscle, yellow color with quadratus lumborum muscle, and purple with psoas major muscle. The kidneys has three coverings: the renal fascia, the fatty renal capsule, and the fibrous capsule. The renal fascia is continuation of the transverse fascia. It is condensation of connective tissue that lies outside the perirenal fat and encloses the kidney and the suprarenal gland. It has two layers that cover anteriorly and posteriorly the renal fatty capsule and a suprarenal gland. The kidney is superiorly separated from the suprarenal gland by a layer of this fascia. Inferiorly and medially, two layers of the renal fascia remain separate, but superiorly and laterally they are fused. Each kidney is embedded in perirenal fat that constitutes the fatty renal capsule. The fibrous capsule is thin and it is closely adherent to the kidney surface. The three structures support the kidneys and hold it in position on the posterior abdominal wall. From inside to outside, we have first fibrous capsule, in the middle we have fatty renal capsule or perirenal fat, and outside we have renal fascia. As I told you, the renal fascia is continuation of transverse fascia of abdomen. Inside the kidney we have depression, it's called the renal sinus, and inside the sinus we have renal fat. Renal fat covers the renal pelvis and renal artery and vein. Inferiorly, the renal pelvis is continuous with the ureter. In the right picture, you can see the renal sinus without renal fat. You have to recognize renal pelvis and ureter. The internal structure of the kidney are: outside we have fibrous capsule, and inside we have renal cortex and renal medulla. The red color represents position of fibrous capsule. Inside, the kidney can be divided into an outer pale cortex and inner dark medulla. The yellow color represents position of renal cortex, and the red color represents position of renal medulla. The renal medulla consists of renal pyramids. The renal pyramids are conical or pyramidal structures with a peripheral base and an apex. Apex of the renal pyramids project into the minor calyx as a papilla. The renal papilla has a perforated tip. It's called the cribriform area. Each kidney contains usually 10 to 12 renal pyramids. The renal medulla consists of renal pyramids and medullary rays. 30 to 60 medullary rays extends from the base of one renal pyramid into the cortex. Medullary rays are parts of the medulla inside the cortex. The renal cortex consists of renal columns of Bertin and cortical labyrinth. Renal columns are extensions of cortical tissue that run between two renal pyramids. Cortical labyrinth is cortical tissue that arches over the bases of pyramids and convolutes between the medullary rays. The renal tissue can be divided into renal lobes and renal lobules. The renal lobe is an anatomically and functionally unit of the renal tissue. The renal lobe consists of the renal pyramids and its closely associated cortical tissue. Boundary between lobes is marked with an interlobar artery. The renal lobule consists of the central medullary ray and the closely associated cortical tissue on either side of it, extending as far as an interlobular artery. We shall repeat now that each kidney consists of an outer renal cortex and an inner renal medulla. The renal cortex is a continuous band of pale tissue that completely surrounds the renal medulla. Extensions of the renal cortex, the renal columns, project into the inner aspect of the kidney, dividing the renal medulla into the renal pyramids. The bases of the renal pyramids are directed outward toward the cortex, while the apex of each renal pyramid projects inward toward the renal sinus. The apical projection, renal papilla, is surrounded by a minor calyx. The nephron is the structural and functional unit of kidney. The number of nephrons in each kidney is about 1 to 3 million. The nephron consists of renal corpuscle and renal tubule. As I told you before, each nephron consists of a corpuscle and a tubule system. Renal corpuscle consists of the glomerulus and Bowman capsule. The glomerulus is a tuft of capillaries surrounded by Bowman capsule. The glomerulus consists of afferent glomerular arteriole which continue with efferent glomerular arteriole. Together they form the arterio-arteriolar anastomosis, or rete mirabile in Latin. It means the miracle network. Bowman capsule consists of an outer parietal wall and inner visceral wall that envelops the glomerular capillaries, and consists of Bowman space or capsular space, that is the cavity between the visceral and parietal walls. The Bowman capsule continue with renal tubule. The tubular system consists of the proximal convolute tubule, loop of Handel, and distal convolute tubule. Each collecting tubule begins as a junctional connecting tubule from the distal convolute tubule. Many collecting tubules unite together to form collecting duct, which opens into the apex of renal papilla. The collecting tubules radiate from the renal pyramid into the cortical region to form radial striation called medullary rays. The renal arteries arise directly from the abdominal aorta just below the origin of the superior mesenteric artery, at the level of the intervertebral disc between L1 and L2. The right renal artery passes to the right behind the inferior vena cava and right renal vein, while the left renal artery passes to the left behind the left renal vein. At or near the hilum of the kidney, each renal artery divides into anterior and posterior branch. The anterior division supplies apical upper, middle, and lower segments, while posterior division supplies only posterior segment. The branches supplying the segments are called segmental arteries. The anterior segmental arteries are usually larger than the posterior. On the basis of distribution of major branches of the renal artery, each kidney is anatomically divided into 5 vascular segments. Each segment has its own artery, and between the segments there is no anastomosis. Each of these segmental arteries, after supplying renal sinus, divides into lobar branches. The lobar arteries break up into 2 or 3 interlobar arteries which pass through renal columns between the pyramids. When an interlobar artery reaches the base of the associated pyramids, it divides into the arcuate arteries. The arcuate arteries run parallel to the surface of the kidney between the pyramids and the overlying cortex. The renal arteries do not anastomose with adjacent arcuate arteries, but give branches which pass radially toward the surface of the kidney, which are called interlobular arteries. The afferent arterioles from interlobular arteries pass to the capillaries of glomeruli, which then reunite to form afferent arterioles. The afferent arterioles divide to form peritubular capillary plexus around the convoluted tubules. The capillaries drain into the interlobular veins. The interlobular veins drain into the arcuate veins, which in turn drain into interlobar veins which pass through the kidney tissues to the sinus, where they join to form the renal vein. The venous blood from the kidneys is drained by the right and left renal veins. The left renal vein passes in front of the aorta, immediately below the origin of the inferior mesenteric artery. We shall repeat now the kidney's blood supply. From the abdominal aorta, we have right and left renal arteries. Renal arteries divides into the segmental arteries, interlobar arteries, arcuate arteries, and interlobular arteries. Interlobular arteries continue with afferent glomerular arterioles. They connect with afferent glomerular arterioles and form the arterial anastomosis. Afferent glomerular arterioles form the peritubular capillary plexus. Capillary from the peritubular capillary plexus continue with venous capillaries. Venous capillaries fuse and form the interlobular veins, arcuate veins, interlobar veins, right and left renal veins, and renal veins are the tributary of the inferior vena cava. The lymphatics from the kidneys drain into the lateral caval and aortic lymph nodes at the level of origin of the renal arteries. Each kidney is supplied by the renal plexus of nerves which reach the kidney along the renal artery. The renal plexus consists of both sympathetic and parasympathetic fibers. The sympathetic fibers are derived from TC to L1 spinal segments, and the parasympathetic fibers are derived from both vagus nerves. Dear students, if you have questions about the kidneys, you can send me email.